Let's get ready to rumble!
The patch is a 5x5 centimetre plaster which releases estrogen and progesterone into the system through the skin. It works to prevent the sperm reaching the egg or fertilising it. It does this in one of three ways. It stops eggs being released from the ovaries, it makes it harder for the sperm to reach the egg, and it makes the uterus lining thinner so that a fertilised egg cannot implant itself. Pros: you only have to replace the patch once a week. The patch is not affected by diarrhea or vomiting. There is no evidence that it causes additional weight gain. It can help make periods lighter and more regular, as well as reduce period pains and PMS. It can improve acne for some people, and it also has additional health benefits such as reducing the risk of some cancers. Cons: temporary side effects may occur during the first few months. These could include headaches, nausea, and mood swings. In the first few months, you can also experience some breakthrough bleeding and spotting. It doesn't protect you against STIs. It can cause skin irritation in some women, and it can be seen as it is visible on the outer skin. Some medicines can reduce the effectiveness of the patch, such as those used to treat epilepsy, HIV, and TB, as well as St. John's.
The contraceptive vaginal ring is a soft, flexible plastic ring that goes into the vagina. The contraceptive vaginal ring releases the hormones estrogen and progesterone through the vaginal wall into the bloodstream, which works in three ways to interrupt fertilization: stopping ovulation, thickening the mucus around the cervix, which makes it harder for sperm to get through, making the lining of the womb thinner so that the fertilized egg cannot implant. Pros: it is over 99% effective at preventing pregnancy. It doesn't interrupt sex. It can help make periods lighter or more regular and reduce period pains. You don't have to think about it every day. Each ring stays in place for 21 days. The ring is not affected by diarrhea or vomiting because the hormones don't need to be absorbed by the stomach. No evidence that it causes additional weight gain. It can help improve acne in some women. The contraceptive vaginal ring can also have additional health benefits, for example, reducing the risk of some cancers. Cons: it's common to experience temporary side effects during the first few months, like headaches, nausea, breast tenderness, and mood swings. Some women can experience vaginal irritation and discharge. You may experience breakthrough bleeding or spotting during the first few months. It doesn't protect against sexually transmitted infections. You may not feel comfortable inserting it or removing it. Some medicines can reduce the effectiveness of the contraceptive vaginal ring, such as those used to treat epilepsy, HIV, TB, and the complementary medicine St. John's wort.
The diaphragm is a small dome-shaped cap that works by stopping sperm from entering the womb by covering the cervix. When using a diaphragm, you will need to use a spermicide with it. Spermicide gel contains chemicals that kill sperm. You only need to use diaphragms and caps when you have sex, and you must leave them in for at least 6 hours after sex. Pros: they can be put in before sex, but you will need to add extra spermicide if you have sex more than 3 hours after putting it in. They are not affected by any medicines that you have to take. They don't disturb your menstrual cycle, and they can be up to 96% effective when used correctly. They're also a great option for people who can't use hormonal contraception. Cons: they don't protect you against STIs. They can take a little getting used to before you're confident using them. Some people may be sensitive to the material of the diaphragm or the spermicide used with it. They aren't as effective as other methods of contraception. Some women can develop bladder infections when using diaphragms, and it is recommended that you do not use your diaphragm during your period, so you will need to use an alternative method of contraception at this time.
Who won the battle? You decide. Visit contraceptionchoices.org and select what's right for me to calculate your top 3 contraceptive methods, or speak to us confidentially on 0808 168 1238.